If you've ever gotten a totally unexpected medical bill in the mail, then you know how frustrating it can be and what a headache it is trying to figure out whether or not you really need to pay it. Today, I'm breaking down the top medical claims issues that I see in my office from people on traditional Medicare, and hopefully this information will help you to avoid these types of issues. So I'm also going to talk more about claims issues on Medicare Advantage plans versus Medicare Supplement plans and how those compare. So be sure to stick around to the end of the video for that. But first, I'm going to review the top traditional Medicare claims issues and how to avoid them. Now, if you've ever had a specific claims issue while on Medicare, I want you to comment and tell us about it below so we can hear about that as well. One of the top claims issues that I see with people on traditional Medicare occurs when they are leaving employer, group, or retiree health coverage. Now, many people will enroll in traditional Medicare and cancel their employer plan, assuming that Medicare will now be their primary insurance, which it should. But every once in a while, wires get crossed and Medicare doesn't get the memo. And when this happens, Medicare may deny your claims because they think that you still have employer group health insurance that should be paying as primary. Now, the best way to avoid this is to be proactive. You can contact Medicare as you approach transitioning off of your employer group health plan. Alternatively, you could just wait and see if any claims issues do come up and then contact Medicare at that point. Now, the best number to call is the Benefit Coordination and Recovery Center, and I've posted that phone number on the screen right now. And this is a separate department of Medicare, so you should not have to wait on hold all day to talk to someone. And you can explain your situation and make sure that they have Medicare listed as your primary insurance. Another claim mistake that I see is assuming that Medicare covers a full annual physical examination. Now, Medicare does cover a whole slew of preventative services. You can see many of them listed here, and they cover these at 100% with no out-of-pocket cost to you. But Medicare does not cover a full annual routine physical examination that includes testing and blood work. So Medicare covers what they call an annual wellness exam, and they cover that at 100%. But they define this as basically a visit to your doctor to talk about a prevention plan and do a health risk assessment. So it's really important to know the difference. If you want to get a full annual routine physical examination that includes blood work and testing, be prepared to pay out of pocket for those services. Alternatively, you can just get your annual Medicare wellness exam, and that is covered at 100%. But you want to be sure that when you're scheduling your appointment with the doctor, you're telling them that you just want your Medicare annual wellness exam. And this will help you avoid unexpected medical bills. The third claims confusion, we see this every year, is folks on traditional Medicare forgetting about the Medicare Part B deductible. So everyone that's enrolled in traditional Medicare Part B has to meet the Part B deductible before Medicare kicks in. And in 2023, this deductible is $226 per year, and it resets every January 1st. So this is the amount that you have to pay before your coverage kicks in. So even if you have a Medicare Supplement, Plan G or Plan N, which are two of the most popular plans, you're still responsible for that $226 annual deductible before Medicare and your Medigap plan kick in to cover the rest. Something to keep in mind, if you have created a mymedicare.gov account, which if you haven't yet, you should definitely do this. It's a very helpful online portal where you can see information about your Medicare claims and your Medicare plans. But on your mymedicare.gov account, if you're looking at your claims, it may show that your Part B deductible has been satisfied because Medicare will register that as satisfied when they receive the claims from your provider. But that doesn't necessarily mean that your provider has received their payment from you. So you should track what you've paid to your provider, your doctor, so that you can determine whether or not you've met your Medicare Part B deductible, which again resets every January. Finally, the other common claims issues that I see have to do with incorrect diagnostic coding. So there are certain services and procedures that Medicare only covers if a patient has a certain diagnosis. Now, if the doctor's billing staff codes that procedure correctly, but they don't have the correct coding for the diagnosis, then Medicare may reject that claim. And the best fix for this is generally getting with your doctor, making sure that they have the correct diagnosis coding on the claim, and then having them resubmit the claim to Medicare. I want to insert here that in my office, we absolutely help all of our clients with billing and claims issues. We do this as a free service for our clients. These issues can be annoying and a headache. And so the feedback we get from our clients is that they really appreciate having us in their corner to help with these types of issues as they arise. Now, hopefully they don't arise, but if they do, then we're here to help. Now, when it comes to Medicare supplement claims versus Medicare Advantage plan claims, this is a question I get a lot. So if you have a Medigap or Medicare supplement plan, like a Plan G, Plan N, Plan F, these plans are supplemental to your traditional Medicare benefits. So you have traditional original Medicare as your primary insurance, and your Medicare supplement plan is your secondary insurance. So when you go to the doctor or the hospital, they submit the claim to Medicare first, and Medicare either approves or denies the claim. Now, if Medicare approves the claim, then usually Medicare talks to the Medigap company and sends the claim over to them, and the Medigap company has to approve and pay in a timely manner on any claim that Medicare has approved. So the claims process is pretty simple in that respect. On Medicare Advantage plans, it works a little bit differently because the doctor and hospital doesn't bill Medicare directly, they bill your Medicare Advantage plan. So let's say, for example, you have a Humana Medicare Advantage plan. If you go to the doctor or hospital, they bill Humana for your service or procedure. So in this example, Humana decides whether or not they approve or deny the claim. Now, I have another video that I've linked below that goes into more depth on Medicare Advantage claims and how they work and how claims issues work on Medicare Advantage plans. So be sure to check that out if you're interested in learning more. So there's an old saying that goes, an ounce of prevention is worth a pound of cure. So knowing about these types of issues before they come up can be really helpful so that hopefully you can avoid these types of claims issues when you're on Medicare. And of course, if you need help with your Medicare insurance, that's where we come in. We are a licensed independent insurance brokerage. That's how I make my living, is by helping seniors on Medicare to find and enroll in the best plan for their needs. And we offer free policy service for life. So we would be more than happy to assist if you want to give us a call. Thank you so much for watching, and we'll see you soon.